is Azar, Doctor of Physical Therapy again. Today's session is about frozen shoulder. I'm going to show you some exercises for that injury. This injury usually happens for people between 40 to 60, women with some underlying disease like diabetes or other stuff. So people in this injury, they cannot really move the shoulder. Everywhere looks stiff. So that ball and socket joint gets stiff without any reason. No trauma this time, no accident, nothing. So just time passes and they start feeling like more and more stiff during the months, between 6 months to 2 years. Even sometimes doesn't go away by itself, but sometimes it does. Usually physical therapy is very helpful on that cases. I'm going to show you the picture of the joint capsule. This is the joint capsule right here, okay? That's surrounding of the joint, ball and socket joint. This is the humerus bone, this is that triangular scapular bone, and this is the healthy capsule right there. And this is the unhealthy capsule that got stiff and inflamed. You see how red it is? In these kind of injuries, usually when the capsule joints start getting stiff and stiff over time, then we're going to lose the range of motion. So what's the best exercises for that? Yes, the range of motion exercise. I'm going to show you a couple of range of motion. The reason that I picked this corner, because the first and most important exercise is the corner stretch. What we're going to do first, we're going to try to open up that muscle and stretch this pectoralis muscle, the big muscle right here. We call it pectoralis major, and we have a pectoralis minor and the deeper a little bit there. So we're going to stretch both of them with a very simple exercise. First of all, I'm going to show you in the corner. I'm going to put my elbows on the wall. I'm going to push myself in. 1, 2, 3, 4, 5. You see my shoulder is almost 90 degrees to my body, right? And I'm going to hold it for 30 seconds. You can do up to 5 times, even more, depending on how your injury is progressed. The second exercise I'm going to show you is almost the same, but we're going to go higher a little bit. So this is for another head of that same muscle, which is pectoralis major muscle. We're going to hold it again, 30 seconds, and release. The last exercise on that is going to be down there. So you can go down, push, hold, and relax. 30-second hold. Remember, for stretching the muscle, for increasing the length of the muscle, we need at least 30 seconds to 1 minute. The second stretch is going to be the shoulder capsule stretch. As we know, the capsule is surrounded all the joint from the anterior, which is forward, posterior, which is backward, and underneath, and up there. So usually the back of the capsule gets really tight, and that's why people cannot go back, and women complain we cannot fix our bra, we cannot bring our hand back. So we usually want some kind of stretch to that back of the capsule. So what's that stretch? Just like that. You can tell the back of the capsule is stretching. And for people with a frozen shoulder, they're not going to be able to easily go that way. They usually go up to here and say, ouch. They can't do more than that. Okay? But hold it again for 30 seconds. Remember, the hold is big. The third exercise is going to be internal rotation. It's a pure internal rotation. You're going to have a towel again, and you're going to put it back there. I'm going to show you back here. And like washing your back with a towel kind of thing. Right? We're going to do it this way. We can hold, even up to 30 seconds again, and release. They may not be able to go up, that's fine. They may be staying down there, that's okay. Go as much as you can go. Gradually, remember, that's the key, gradually. Do it, and it's going to get better and better. Another exercise I wanted to show you is very easy. You don't need any equipment. So basically, it's a shoulder ladder. We're going to go up. That's the active assistive range of motion. Hold it there. And then you're going to go back up, down, up, hold, down. You can do it sideways also. Up, hold, down. Okay? We can do it with the ball. That's going to help us. Okay? That's assistive with trying to assist the shoulder to get to the range, right? And then sideways, up there. Then we can do it some kind of, we call it in the clinic, cleaning exercises, okay? They can help you to clean. There we go. Right, and sideways. Okay. These are the most important stretches for the frozen shoulders. So I can do some exercises also with the cane if you have it available. I'm going to show you right now. If you have a cane right here, this is active assistive also. So imagine this one is the hand that's not going to go up. So this is the one that goes. You're going to get it close to each other. With the help of the good hand, we're going to go up and then sideways. Let that cane stretch your shoulder, right? Okay, I guess that's it for all the exercises for the frozen shoulder stretches. We're going to continue these stretches during the months, sometimes in the weeks if you go to the therapy place and they do some manipulation on you. Manipulation and mobilization of the joint is very helpful to loosen up that capsule faster along with the stretches and exercises. But if you cannot go for some reason to the physical therapy clinic for the manual therapy, it's going to take very longer, but still these home exercises can help you somehow. But our best recommendation is always talk to your doctor, talk to your therapist, and see your therapist for couple session at least for manual therapy before just doing home exercise program, because they are big. Manual therapies are very helpful. Okay, have a great day. Thanks for watching.